Welcome back to County Connection. For our final segment of this January episode, we're going to be talking about the Community Health Improvement Plan. And here to tell us all about it are Amy Wineland, our Director of Public Health, and Tamara Drongstvedt from the Family and Intercultural Resource Center. Welcome, Amy and Tamara.
Thanks, Julie.
So we talked about the Community Health Improvement Plan last month and kind of talked about a broad overview of this whole process, which is looking at our health needs across the community, the assessment that you did to determine those needs, and then turning that into a plan. And then, Amy, can you just give us a quick summary of that process?
Sure. So the process took over 10 months. It included over 30 partners and agencies that collaborated in identifying what our top priorities are after we did a really robust assessment, including telephone surveys, paper surveys, both in English and Spanish. We did focus groups, both in English and Spanish, and then we also did a survey for our key stakeholders in the community.
Okay, great. So this is not just public health, but a broad coalition of partners throughout the community, including the Family and Intercultural Resource Center, or the FERC, as lots of people call it. And so one of the main strategies that is part of the plan focuses on health equity and the social determinants of health. So can you refresh our memory on what exactly those concepts are all about?
Sure. So one of our priorities identified through the process was health equity and the determinants of health. So health equity is defined as the attainment of the healthiest anyone can be, and that everybody should have the chance to do this, regardless of who you are or your socioeconomic status. And to address health equity, one strategy is to look at the underlying root causes of those things that impact our health. And these are systemic conditions typically, and include things like food security, healthy and affordable housing, safe housing, good paying jobs, education, access to health care, and things like that.
Mm-hmm. And so how will you go about addressing this priority?
Sure. So the overall goal is to improve our community-wide equity, our community-wide equity in addressing our under-resourced populations and understanding those complex needs, as well as increasing our capacity to meet the needs of our under-resourced populations.
So a lot of this kind of comes down to factors that in many cases may be outside of the control of any individual that may stand in the way of their opportunities to have good health, and their opportunities, whether it's to access resources or what have you, to achieve the best health that they can have.
That's correct. Yeah.
Okay. So Tamara, the FERC is very much involved in fact, taking the lead on this priority in a lot of ways. So can you kind of talk about this model a little bit and how the FERC will be taking the lead?
Yeah, so when I think about, or when we at the FERC think about the social determinants of health, we're really thinking about all those things that doctors necessarily wouldn't have an impact on. Things like, as Amy said, housing and childcare, definitely lifestyle choices, whether or not folks have the ability to access the rec center, for example, whether that's affordable to them. Mm-hmm. And so one of the strategies that has increasingly been used across the country to help communities like ours and help populations like ours work on those social determinants, they're called community health workers. But they're really people that have a broader range of training than the normal. They understand things like how do we help people enroll in health insurance. They understand, how to do screenings around some basic mental health factors. But they're also looking at, okay, are there ways that we can improve this person's housing situation? Or are there things that we might be able to help them add in their life that could make big impact in terms of their health, but just have a small impact in terms of their day-to-day life, right? So, walking up the stairs instead of taking the elevator, those kinds of things. things. So really, community health workers are peers that just meet with folks who may have some challenges and barriers and help brainstorm how that person can overcome some of those challenges and barriers, with the ultimate goal of helping them improve their physical and emotional health over the long term.
Right, and this is, I think it's a really exciting way to look at health, because at first glance it may not be so obvious, right? Because sometimes we just think of health as health care,
Right.
But really it's such a more holistic approach that has really profound impacts on people's lives and their health.
Exactly. And in a lot of cultures, that is how people think about health. You know, they think about it as that balance between their day-to-day life and their physical health outcomes. And so this is, in a lot of ways, like Amy said, one way to help some of our more under-resourced communities in a way that feels more natural and more like what they might be used to.
Okay, great. And so what does the timeline look like for implementation of these strategies you've talked about?
So we're excited that the Colorado Health Foundation has funded us to begin work with some community health workers. We'll begin, I think we just posted the position at the FERC, and so we'll hire hopefully sometime in January and then start training with some nationally recognized trainers in February. And so hopefully these folks are ready to go at the end of February.
All right, fantastic. So if people are interested in learning in more detail about these strategies or the Community Health Improvement Plan overall, Amy, where can they find out some more information?
Yeah, sure. The entire assessment, as well as an executive summary. It's a large document, so if you're not interested in reading through all the data, it's posted on the county website, as well as the implementation plan. So all of the strategies are listed there in detail of what will be happening over the next 5 years.
Excellent.
Yeah.
And then Tamara, if people are interested in learning more about the FERC and some of the services and programs that you offer, how can they do that?
So our website is www.summitferc.org, and all of these programs are listed on the website.
All right, fantastic. Well, thanks so much to both of you for the hard work that you have poured into this plan and the hard work that lies ahead that your organizations will be doing to improve the health of Summit County residents.
Thanks,
Thanks,
Julie.
Julie.
And thanks to those of you at home who've joined us for another episode of County Connection. We'll look forward to seeing you next month.